The following presentation is for educational purposes only and should not be used to diagnose or treat any medical condition. Please consult your healthcare provider for personalized medical advice and care.
Caregiving. Care for yourself while caring for others. A caregiver is someone who gives basic care to a person who has a chronic medical or intellectual condition. A chronic condition is one that lasts for a long time or never goes away. Some examples of chronic conditions include special needs children and adults with cerebral palsy, cancer, effects of stroke, arthritis, diabetes, Alzheimer's disease, and other forms of dementia, as well as other mental health conditions. Caregivers help with many tasks. These include shopping, preparing and administering meals, cleaning, taking medicine, bathing, and dressing. Caregivers also provide company and emotional support. Some caregivers are paid, many are friends or family members of the person who needs care. Providing care for a loved one can be rewarding, but it can also be very challenging. Hello, I am Dr. Raquel, and I have had lots of experience both professionally and personally in this area. So let me welcome you to what I believe is going to be a topic that resonates with many people. This video is another installment in the Patient Education Archive from the family practice of Dr. Ralph Aziz. So before starting, let me state clearly that this presentation is for educational purposes only and should not be used to diagnose or treat any medical condition. Please speak with your healthcare provider for personalized guidance. So, why is caregiving challenging? Caring for a loved one who is seriously ill is never easy. You are often on call most of the time. It makes it hard to juggle the other parts of your life, like work, chores, caring for children, and caring for the person who is sick. You may often feel like you don't have any free time. Caregiving is also hard because you very frequently see many changes in your loved one. For instance, the person you're caring for may not know you anymore, or he or she may be too ill to talk or follow simple requests. Sometimes he or she may have behavior problems like yelling, hitting, or wandering away from home. This may be especially true if the person you're caring for suffers from dementia. You may have a hard time thinking of the person in the same way that you did before he or she became ill. So, is it normal to have many different feelings about being a caregiver? Yes. At times, you may feel scared, sad, lonely, or unappreciated. You may feel angry and frustrated. You may feel guilty or feel that life isn't fair. You may feel resentful of the person you are caring for. All of these feelings are normal. Another question is, as a caregiver, am I at risk for health problems? The answer is yes. Because being a caregiver is so hard, your health can suffer. You may feel stressed or overwhelmed by being a caregiver. You may find that you spend much of your time caring for others, but you neglect your own health. Some of the tasks of being a caregiver can put extra strain on your body, like lifting or bathing your loved one. Being a caregiver also can cause financial stress. You may avoid going to the doctor so you don't have to pay for visits or treatments, or you might not have time to go to the doctor when you need to. You may see an increase in depression, anxiety, or difficulty sleeping due to the increased stress on your mental health. All of these things can affect your emotional, mental, and physical health. Studies show that caregivers have an increased risk for the following health problems: alcohol, tobacco, and drug abuse, anxiety disorders, cancer, diabetes, heart disease, high blood pressure, high cholesterol, heartburn, infection, obesity, and pain, such as muscle or joint pain or headaches, stress, and depression. How can I tell if caregiving is putting too much stress on me? It's normal to have a lot of conflicting feelings, but it's not normal for these feelings to last for a long time or to disrupt your life. Being a caregiver is hard. Some doctors think of caregivers as hidden patients. Studies show that caregivers are much more likely than non caregivers to suffer from health problems. So, how can you combat some of these ill effects? Firstly, getting plenty of sleep. Your body needs to recover physically and mentally every night. If you're short on sleep, try to take naps when your loved one does. Secondly, managing stress. Stress affects your mental, emotional, and physical health. Learn ways to manage it so it doesn't take over your life. You may want to review some other videos in this patient information series, which deal with this topic of stress. Thirdly, visit your doctor for regular checkups. Get regular checkups even if you don't feel sick. Your doctor can help you stay healthy by providing preventive services. These include health tests, screenings, and vaccinations. They can give you advice appropriate for your age, sex, and medical and family history. These services help prevent disease and will help catch any medical conditions you do have early. Fourthly, staying organized. Caregiving is often a full time job, but you may be doing it on top of other responsibilities. These could include a paid job or taking care of your children. Make a schedule with your family. This will help all of you stay organized and will help you manage the demands on your time. Don't forget to schedule time for things you enjoy. These could include visiting with friends or going out to dinner or a movie. Fifthly, talk to your loved one and your family. You may feel that you shouldn't burden people with your feelings because you're not the one who is sick. However, talking about the illness and how you feel can help relieve stress. Talk with your loved one, other family members, or friends who can provide support. I want to emphasize that it's not wrong, evil, or selfish to have such feelings. Remember that you are only human and you're trying to do a superhuman job. These things affect us psychologically and cause a lot of caregiver fatigue. It is a real condition. Taking care of yourself is not selfish, nor is it irresponsible. You must realize that your patient depends on you to the fullest. What would be the position for him or her if you were to be hospitalized or incapacitated? Cultural norms affect our perspective on this. Many siblings or children, even parents who are caregivers, feel that caring for themselves or taking a break amounts to abandonment of their loved one. Breaking this incorrect sentiment is key. Actually, these guilty feelings are unfounded and are usually based on attachment and not necessarily real emotion. You need to consider the situation logically. Caregiving is a marathon, and you need to be fit to participate. Making sure you are healthy and psychologically prepared and refreshed only benefits, assures, and reassures your patient in the long term. What I'm saying is a healthy, prepared caregiver means a better cared for patient. You may also want to look for help in your community or join a support group. Community services provide different kinds of help, which may be paid services or even sometimes free. These include meal delivery, transportation, and legal or financial counseling. They also include home health care services such as physical therapy, nursing, or respite care for you. There are palliative care options in Trinidad and Tobago about which you can consult your physician. You may want to check your church or religious institution for services or volunteers who can help you. You can also ask for help from support organizations or join an online community, at the very least, for moral support and information. Support groups allow you to share your feelings and experiences with other people going through similar situations. Your doctor may be able to suggest local support groups. Social media is a resource as well. Online tools, forums, and mobile apps are also available to connect you with people in a similar situation. Recognizing that you need help takes strength and courage. Sometimes it's helpful to talk with a counselor about how you're feeling. Your doctor can refer you to a therapist who specializes in the kind of counseling you need. Sometimes the stress of caregiving for a loved one becomes overwhelming. This can lead to stress overload and even depression. Watch out for these signs. If you think you are suffering from stress overload or depression, call your family doctor. He or she can help you manage your feelings and stress. This could be through stress management techniques, counseling, or medicine. So, ladies and gentlemen, having come to the end of this presentation, let's summarize. Caregiving is one of the most satisfying tasks that a human being can endeavor to accomplish. It requires a lot of patience, a lot of understanding. It requires a lot of skill, knowledge, organization, and dedication. To better achieve the objective of caregiving for the sick or an infirmed person, it is important for the caregiver to understand what is his or her role in the circle of care. You are at the center of this circle, and it means that you are both the strength and potential weakness of your charge. Recognizing your personal limits is crucial, and make sure that you do not become overwhelmed. It's not wrong to have negative feelings, it's entirely normal. and part of the journey. Get help when you need it, get support when you need it. That will only benefit you and ultimately your patient. Sad to say, caregivers are hugely unappreciated, and this often engenders low self esteem among the ones who administer care. There is very often a sense of being a slave to the process. Even in large families, it always seems that one child bears the brunt of the burden. A lot of these issues are social. Early intervention can prevent negative patterns setting in. Awareness is the key to forging better outcomes. So, in closing, I'd like to say thank you to Dr. Aziz for allowing me to provide information on this topic. I know it's been a lot, but I hope it would serve you well in caregiving. Let me also refer you to other videos in this patient education series related to stress, mental health, and general care of chronically ill persons. Thank you for watching. Until the next time, remember your health, it's our priority.
Ready to take the next step in your health journey? Call us at 868-664-0531 or email us to book your appointment today, or book online at www.drralphaziz.com. Also, look us up on Instagram for health tips and updates. Your care starts with a conversation. We're here when you're ready.